Okay, so for my next exercise, we're going to use what's called a wobble board, and what it has is an unstable surface, and this is important for proprioception. When you damage your ankle or knee or hip, you'll lose some of that proprioceptive firing because the receptors are damaged. So what we want to do is retrain those again. If you don't train those proprioceptive receptors, what will happen is it'll break that kinetic chain, and your movements won't be as safe. So proprioception is very important because this tells you where you are in space. So if I close my eyes and I bend my knee, I know where I am. Or if I take my arm and move it back here, I know where it is. So proprioception is very important for skaters because we are always on an unstable surface, and to train these these receptors is very important to prevent you from getting injury to your ankle or decreasing the chance, or to the other joints in the lower extremities, or also as good rehabilitation once you have injured it and the ligaments have finally healed. So what we'll do is one of the first exercises you can do with the wobble board is just use 2 feet. You can actually, if you can use something that will stabilize you at first, because you may feel a little bit of a wobble, pardon the pun. And so what you're going to do is try to balance on the wobble board, and do this for about 20 seconds at a time. So once you get that feeling of where you are in space while you're doing this, then what we're going to do is we're going to start doing lateral movements. So going back and forth. You can also do going frontwards and backwards. To provide more of a strengthening challenge to those muscles, and it's also important in skating. We're going to do a little bit of squatting, so we can do a little squat while we do this and do these movements. Okay. For more advanced techniques, what you can try is using 1 foot and trying to balance. What we'd like to do is try to not look down at the floor when we're doing this, because when we are doing our sports or walking or anything, we're not usually looking at our feet. We're looking forward. So practicing this without looking down is very important as well. So try with both legs, doing 1 foot as well. Okay. And almost. There. Okay, so these exercises you can do every day. If you do find that there's any problem with pain, I would suggest that you go see a health professional about it. But this should help if you do have any proprioceptive problems. Even if you don't think you do, it's always good to train these anyways. So that's it.